But there is somebody that we talk to on a regular basis here on the program that can really help make you feel better. And that person is Dr. Ole Olson from Central Iowa Neuropathy, who is joining us right now. Dr. Ole, how are you today?
I'm doing great, Lou. Thanks for having me again.
Hey, we are going to be chatting with you because you have some ways to make people feel better, especially if they're experiencing some pain they might not be able to identify, and that's what we're here to talk about today. We're talking about neuropathy. And first of all, let's talk about some of the things, maybe some of the signs that people might be experiencing that could signal, yeah, this is something you really need to get looked at because we're talking about neuropathy.
Absolutely. Yeah, peripheral neuropathy is actually the term used for any damage to the nerves outside of the central nervous system, which is your brain and spinal cord. So any of those nerves going into your arms and hands, your legs and feet, or even into your organs. You mentioned pain. That's one of the more common ones. It could be a sharp electrical pain, could be a burning pain, or even like a freezing cold pain. But a lot of times we see people that come in and actually they just have more of a numbness, sometimes a tingling, like a dead feeling. So just really heavy feeling in their feet. And that's a lot of times an early trigger as well as balance issues. So anytime someone's dealing with any of those symptoms, early detection is the key. So the sooner they can get in and get checked, the better.
So you're saying that if somebody is experiencing something that just doesn't feel right, maybe in their arm or their feet or their legs, this could be a signal of peripheral neuropathy.
Absolutely.
All right. Now, the next question is, all right, they're experiencing this. Is there anything that can be done about this, or are people just reliant on going in and taking a pill of some sort?
Yeah, that's really one of the most common misconceptions is that this is something that's not treatable. And a lot of times what people do is they just end up turning to the typical medical route of taking pills and just kind of sitting around and waiting while it gets worse. To me, that's not an answer. And so we went out to find a solution for this disease. And we've actually been able to not only stop the progression, but we've been able to reverse this disease and actually get people back, feeling better, functioning better, really enjoying a better quality of life.
So how do you go about doing this? What are some of the things that you can do to help reverse some of these issues?
Yeah, we use a number of things from dietary changes, vibration therapy, light therapy, some electrical therapy. We really do a comprehensive test and analysis in the office to determine what does that person need. I don't like the old saying of throwing spaghetti against the wall to see what sticks. Like I want to make sure we know what that person needs so we have the best chance of helping that person heal and get better.
Now, when they come in, is this something that can benefit everybody that is experiencing this?
Yeah, the biggest problem is people wait too long. People think that it's not a big deal and they put it off and put it off. And if they wait too long, that nerve damage can actually become permanent. So that's one of the things we're testing for in our office.
All right. Now, you understand we have a chance for people to come and get involved in a seminar where you're going to go through all the different things you can do and really teach people about the treatment plans. Is that right?
Yeah, absolutely. So we've got a free seminar coming up next week. Space is limited, so call right away. But we're going to offer my book for free to everybody that comes out to our seminar so they can learn more about this condition. And then if they'd like, they can get checked out and see if it's something we might be able to help them with.
Now, explain to everybody where your practice is located. We saw Ankeny there, but what general area are you guys located?
Yep, we're at 210 Northeast Delaware Avenue, so we're right on the corner of First and Delaware. We're inside the Great Southern Bank, the big two-story bank right there in the corner.
Oh, okay, it's easy to remember and easy to figure out where that is. And when people come in to the seminar, what kind of knowledge will they take away from that?
Really having a better understanding of what's actually happening inside their bodies with this condition. And then understand that there are some things that can actually be done for this so they can improve and get better and get back to living life pain-free.
Okay, you did mention is limited space on this, so you want people to call in, and here is the number. It's 505-3700, 505-3700, 515 area code, of course, is what we're talking about here. But you're also going to supply them with that book that you talked about, right?
Yep, got a copy of my book they'll take home free. So they get to learn even more about what I do in our office and how we can help them.
All right, Dr. Ole Olson, thank you so much for that information. Hopefully you learned a little bit more about peripheral neuropathy and how it can be treated and how you can learn more about how it can be treated at Central Iowa Neuropathy. Thank you so much for your time, and we will talk to you next time.
Thank you.